Crazy question for you to see what you think about this. So, 1984, I think it is, that we make advertising. Can you look up when we made advertising big pharma legal in America? I think it's 84. And I think Prozac came out in 88, 87. If you can look up when Prozac came out and when we made it legal. What year is it? When we made it legal, is it, search that, zoom in, you'll see it. Okay. Anyways, while you're doing that, what do you think would happen if, out of a couple hundred countries in the world, whatever the numbers, 193 or 208, okay, only 2 countries Big Pharma gets to advertise in those countries, New Zealand and America, okay? What do you think about if a president campaigned and said, moving forward, guess what? If your product is good, they'll find it. No more advertising on media, TV, YouTube, social. Big Pharma, not necessary. Because it's legalized drug dealers. If your work is great, if it's doing phenomenal, great. I feel a little bit uncomfortable that this person I'm paying $15 million a year, $10 million a year, this much money per year. Of course they're going to say good things about the drug because I'm getting the money. Let's not do that moving forward. What do you think about us eliminating as a candidate? Would you, somebody who is on the, maybe on the left, supportive of more on the Democratic side, would you say, I actually would entertain the idea of getting rid of that?
Well, and there's another very good argument for getting rid of drug advertising, which is, one of the big issues
85
with drugs at this, pharmaceuticals at this point is how much they cost. I mean, the fact that people can't afford the medication they need. In a world where there's advertising, why are we, through Medicare or Medicaid or through our insurance, paying these drug companies to advertise? I mean, it's not just that we may be getting unnecessary prescriptions. It's that you're adding to the cost just by the cost of advertising. It's a very legitimate question. One of the things that and I certainly knew this from my time at CNN. In an age when a lot of formerly big advertisers don't advertise anymore. Like, for example, I'm going to take the liberty of saying that all of you are old enough to remember when airlines used to advertise on TV all the time.
Oh, big time.
They don't advertise at all anymore.
Nope.
You never see a Delta ad, a United ad. If you turn on CNN, if you turn on MSNBC, if you turn on Fox, it's one pharma
all
ad after another.
It's not just left or right, it's everybody.
Well, and also this has to do with the fact that the news audience is older.
Exactly.
And I used to joke, I mean, this is sort of a dark joke.
I love it.
About when I was at CNN that, if you look at the ads, that our audience is 100% dying. Because of what they need. Like, there was one ad that was used to run all the time. It's like, take this drug if you have advanced lung cancer. Oh, my God. It's like, can't we have a drug for people who have just a little bit of lung cancer?
Yeah,
where it's like, why do we have to have, like, advanced lung cancer?
Yeah.
But that's the audience. And people, Fox has the biggest audience. They also have the oldest audience. And, but across the board, the ads are for, pharmaceuticals, because that's.
I want to show something, Rob. I'm going to show this to you because the point you're making right now. So, do you know the patent laws in drugs in America? Do you know the patent laws? So the patent laws in America, pharmaceutical companies get 12 years guaranteed market exclusivity for biologists, and 20 years for each patent. Okay. So, it used to be 12. They raised it to 20. A senator and a congressman from the left and the right agreed to say, let's lower it to 12. This is not cool. Yeah. And then eventually they brought it back up. I'm going to send you these two things. So 2 of the most popular drugs that we take in America, one of them is, listen, excuse my English being my 5th language, Lipitor. Am I saying it correctly?
Yeah,
it is.
Okay, all right. So Lipitor, Rob, I'm going to send this to your MacBook.
I take it myself. It's a cholesterol
there you go.
drug.
All right, so check this out.
Cholesterol, yeah.
Rob, if you can receive it and pull it up, when you see this on what happens the year the patents go away. Okay, so check this out. If you can show this. Rob, did you get it or no? Okay. I would run on this, and I would show this, because this whole concept of advertising pharma and us losing these people because they're getting paid behind closed doors, there's loyalty to whoever helps pay your bills. There's a loyalty to whoever's the advertiser for the most time. Watch this, for the most part. Rob, do you have them?
Uploading. It's taking
it's
a second.
uploading.
Yeah.
Okay. So, there you go. So if you see the drop-off of these two numbers, the year the patent is over with, so it's showing what it's selling for and how much the patent expires. Before we even look at it, zoom in a little bit. Can you zoom in a little bit?
When
so this is
become
Lipitor.
generic,
Yeah. So this is Lipitor. Okay. Zoom in and go up a little bit the other way so we can see the bottom numbers. Okay. So check this out. Look at that. How high it is. Okay. It's going 1.5 billion. Do you see the chart?
Yep.
So all the way at the top, look what kind of numbers they're doing.
12 billion's the top.
12 billion.
Past 12 billion.
2012 is when the patent expires. Look how low it goes from doing 12 billion at its peak to $76 million. Go to the next one. This is Lipitor. Now let's do the next one here, which is for a drug for bipolar and schizo. Look at this one here. 5.628 billion peak 2011. It expires. Look how quickly it drops, and look how much it's worth in 2021. 92 million versus 5.2 billion in revenues from one drug, okay?
Wow.
So this is the part where Americans are like, dude, so really, it didn't really cost you this much to make it? No, bro, it's like pennies on a dollar. But we charge you $600. Damn. There's a part of this where I'm like, look, I don't mind giving you a patent. You ought to get it because we want innovation in this space. No question about it. Like, listen, cancer, we got to cure it. And there's respect to a lot of advancement that we have made. We have to salute.
100%.
My dad's 81 years old. He should have been then at 65 years old. Ken Golden, who is one of the original guys from Home Depot, billionaire, $4 or $5 billion guy. He had a phenomenal debate with Elizabeth Warren 2-3 years ago. He said, my dad died at 62 years old. He's saying this in his book, I Love Capitalism. He said, but if my dad would have been born 20 years later when they invented blood thinners, my dad would have lived in his 80s. He says, because I've been on blood thinners since I was 60 years old. And he's now 83, 84 years old. So what an interesting testimony. So we want the innovation, but guess what? 20 years patent? I don't know about that. How about we lower it to 5 years? And then 5 years later, the person that came up with the patent, you get to sell it to other people, and whatever they sell, 50% comes to you, which means you release the patent that there's still some kind of profits coming back to you. I think this is another thing that's going to force Big Pharma to be more honest. If we eliminate advertising and if we minimize the patent from 20 years to 5 years, it becomes a little bit more competitive.
You make a great point. We have Medicare and Social Security, which is a safety net, originally designed as a safety net to help the elderly. So there is a very real spreadsheet that goes on in Medicare to getting life-saving drugs, life-extending drugs to these people. And it is kind of funked up that the drug companies have less of a copyright or patent than Mickey Mouse. A couple years ago, you read about how hard Disney was working to protect the image of Mickey Mouse because of its commercial value and the branding value to Disney. So why do we have those things which argue that, hey, it was built by a company, it's entertained by people, you can do it, but it's not necessarily as critical as other drugs are. And I think what you're bringing up, Pat, is instead of opening the floodgates to the generics, because they always talk about the Canadian generics. If you go deep into the Medicare discussion, you go straight to the Canadian generics. 24 months after the expiration. Hey, well, why can't we buy the Canadian generics for our older people to say, hey, you can still get your Lipitor, but you'll just get the Canadian generics. It's a lot less because the patent's up. Now we can get it over here. Why not make the licensing option take away the advertising and provide a longer-term licensing option at the same time finding ways to, make the drugs themselves more affordable? Because we can all scream about the cost and everything, but there's a couple realities. The competitive set in the United States is resulting in these drugs. These drugs are not being invented around the world. And this is the reason at Johns Hopkins, you've got, and you know about this, you're familiar with Washington, you've got entire floors at Johns Hopkins that have special security because foreign dignitaries are coming here for advanced healthcare services. Why is that? Because the competitive set of capitalism and things and free enterprise in America are resulting in competing to make medical instruments and stuff. So the right thing is happening because that competition is resulting in great things. But then long term, we need to get the cost under control. And you take away the advertising, and Pat, you're right. You put licensing on it, and you will take 5 steps in that direction.
Hey, if you enjoyed this short clip, you want to watch the whole thing, click over here. But if you want to make 2023 the beginning of the greatest years of your life, I host a conference once a year. It's called the Vault Conference, where 3,000 CEOs, executive, entrepreneurs from around the world come together to strategize for 3.5 days. This year it's going to be at Miami Diplomat Resort. And the speakers this year is going to be Tom Brady. He'll be there. I'll be interviewing him. Mike Tyson, Will Guidara, the guy that ran 11 Madison in New York. If you run a business, if you're a CEO, entrepreneur, and executive, this is not an event you want to miss out on. Get yourself, your spouse, your business partner, your running mates registered, and I look forward to seeing you there. Click on the link here or see the link in the description, and I hope to spend 3.5 days with you in Miami in August and September. Take care, everybody. Bye-bye.